Namaskara, I am Dr. Sunita Rana Agarwal from Dr. Agarwal Hospital's Bangalore. I am an ophthalmologist and I do genetic medicine. Photophobia can also be due to eye strain, but more often than not, it is a problem. So either the patient has uveitis, he has infection, he has glaucoma, he has a corneal ulcer, or he's a different patient, that means he's albinoic and there's some genetic mutations involved over here. What it means is that the light is hurting your eye. This can usually, very common cause is if some foreign body goes into our eye. We're riding a bike, no helmet, no visor. The particulate matter in the air is so high that something or the other is definitely going into your eye. I recommend please put on your helmet, please put on a visor to protect your eye, mouth, nose from all this particulate matter. This way we are able to reduce the chances of the photophobia coming into you. Second, when you come from outside to inside, wash your face, splash water on your face, on your eyes, keep your eyes open. Preferably use a small bowl, fill it with mineral water, wash your eyes. So any deleterious material, any allergic material gets washed away in that. When it does not happen with that, we need to go to more serious conditions like uveitis, corneal ulcer, infections, glaucoma. The brilliance of the sun can sometimes be fun. However, at this point, it's not fun when you look at the sun. When you're looking at the sun, you're getting the whole of the electromagnetic spectrum. Here, the brilliance is so much that we are not able to look at the sun, and that's a good thing because the sun is coming at ultraviolet and infrared radiations. This can produce a macular burn. So it's better for us not to look at the sun. Our problem comes when we look at an eclipse, because at that time the brilliance of the sun is not there, yet the infrared and ultraviolet radiation is still there. So we like to use glasses which are solar eclipse glasses. With this we can look at the sun, but it's preferably ever to not look at the sun. You can sway in the sun with your eyes closed because the sun itself gives us a lot of vitamin D and gives us a lot of other strengths that can help fight our immune system. Not really. If you're shutting your eye with this, then we're looking at something which is called photophobia. That means you're looking at light is painful to the eye or you're not able to do so. But yet, it's a better idea to wear sunglasses even for normal people whenever you go out in the sun. Protection from the sun with the sunscreen and sunglasses is very, very imperative. But when we're looking at photophobia, then we're looking at some disease or the other. The pigmentation is what absorbs a lot of the light. And if we see a contrast with genetic disorders like albinoic eyes. Albinoic eyes, you think they're very fair, very true. However, the retina also is very fair. It does not have the dark pigment at all. The eyes are usually bluish in color. All this is so that the light doesn't get absorbed. We need the pigmentation to absorb the light coming in. And this way, the light gets absorbed, the excess is gone. Only your photoreceptor cells of the retina get excited. They pass on the information and it goes to your brain. That also very true. It definitely can, because with indoor screen time, what we have done is we have stopped blinking. We've got dryness in our eye. Dryness in the eye is prone to allergies and infections. This way, if you want to go back into the outdoor, it will take a little time. We need to adapt ourselves into that. So better to put on dark sunglasses, put on some sunscreen lotion. However, every human being has to have an adaptation cycle. The adaptation cycle should not take us more than 2 to 3 minutes to get adjusted. When it takes more time, then you're looking at some disease or the other. Very often, age-related macular degeneration, uveitis, corneal ulcer, diabetes, hypertension, cataract, glaucoma, the list is endless. Only a doctor can tell you otherwise.